Washington, and I have Curtis. Curtis and I have our brief consultation. I looked at some of his reports. This might be a really interesting case for you to know and see how, even when people are severely injured in any aspect, he actually, and Curtis, you're fine again, I'm getting this, you're okay with me sharing it? He was shot in the back, and so there's fragments, and there's bone fragments in there. We've done some studies. He's got the reports from the other doctors, been sent here. He's here for his neck, not for the low back, so we're going to stay away from the L5, L4 area because the fragments that are in there, as well as the bullet, I'm sure that's even fragmented, is sitting and putting pressure onto the nerve roots as well as the spinal cord. So the doctors that have seen him have said, walking miracle. Obviously those are areas that as a chiropractor I don't want to be touching, but I can work around that and get him some relief. But the whole point of this is, even when people have severe conditions, there's ways that chiropractors can still help you. We're trained appropriately to do that. He's here because he can't move his neck. Big thing that I'm seeing is he's got what we call torticollis, or wry neck. You guys call it, well, my neck feels kinked. And a lot of times that's simply from a misalignment or several misalignments in the neck. Now, there's more severe, like acute torticollis, and different types of them that you see, but we're going to be working with that today. So anyways, his fiancée was a patient and still a patient here. She comes in as she needs to. And I met Curtis, and he now has to be here. So, all right. Curtis, you do HVAC, yes?
Yes.
Okay. So we're going to do some further testing in chiropractic, and one of the things I see a lot of turning of the leg here, short leg on this side. So now we're going to begin with some of the checks throughout the spine. You even notice how the spine is slightly twisted here. Pelvis is lower on this side. So chiropractors look at the posture. We look and assess it many different ways. You could go to 100 of us, and we'll all approach it from a different angle. It's all right, it's just how we practice. All right, so we're going to check a little bit of the motion here of his sacrum and pelvis. Raise this leg for me. Back down. Try the other one. Back down. Fairly close, so sacrum seems to be functioning there. Now I'm going to bend the knees, and we're going to check some of the pelvis, and you see how short that leg goes. Pretty significant. He's feeling pressure in there. So I'm going to go really light on him. I'm just going to pressure test that pelvis this direction and this direction. I think it's actually both. And that's just from years of experience. Does that feel a little less now?
Oh, there's still a lot of pressure.
But and look at how the legs move differently. So huge difference. So you're probably seeing me use a new tool on him. This is actually something I've used in the past on patients. We're adjusting the pelvis, not the lumbar spine. You doing all right?
Mm-hmm.
Take a deep breath all the way in and release it out. Good. Look at the difference. Did that feel a little bit better?
Mm-hmm.
Okay. Now we're going to adjust the sacrum. I'm staying away from the shrapnel, bone fragments in there, the bullet. So he's had all the x-rays, all the exam, all those things have been taken care of. Now you're going to feel the difference here. Do you feel that?
Wow.
Yeah. Huge. So it's it's like chiropractors, we get things back in alignment so you guys drive straighter. That's it. It gets pressure off the nerves, off his nervous system, and it sets up better in new posture. And you can hear it. I mean, he's breathing a little bit easier. And I didn't even get to his main complaint yet. So we're going to do a little bit more here. All right, I want you to take a deep breath in. Release it all the way out.
Oh.
Curtis, you're all jacked up.
Yeah.
All right, you're going to feel even less now when I do this. So the range of motion starts to improve. I mean, there's always going to be a little something, but look at how much further.
There's hardly any
the
pressure.
quadriceps and the hamstrings, just with that. And actually, I could feel it. So chiropractors' hands get very tuned into what's misaligned, and I'm actually feeling the hip on him right here. So we're going to adjust that. And I'm using the instrument because I can get really specific. Kind of like the chiropractic jackhammer, so to speak. Tell me if that feels even better.
It went from being nothing but pressure on my lower back to no pressure at all.
And he's lifting his head. So here's the point of that, and here's the point of this live video for him. I didn't even work on his neck yet. And that's starting to give him it's all connected. It's all connected in there. It's like a domino effect. So when a chiropractor does that, they don't just look at one area, they look at the whole big picture that's going on. Can you turn your head to the right?
No.
No, negative. His right leg went 1.5 inches short. I want you to see this as soon as he did that test. Can you come on over? Don't worry about shaking it. The viewers can see that later. Look at the difference there. Huge difference in that. And he just did that one test. Okay. Now I'll have you go back there. So now we're going to address some of the T6. A little bit more right there. And you don't have to come back over. Both legs are even. So I'm going to address T6. You all right? So I'm right on the vertebrae. Now I'm on the rib head right here. Can you try turning your head to the right? We may have a little bit of change there. A little bit easier?
A little bit.
A little bit. We're working our way up. Okay, raise your right shoulder for me. So we're doing some muscle testing right there. Back down. You okay? So I'm right at T4. Head to the right. A little bit better, wasn't that?
A little bit.
Okay. Shrug both shoulders backward. Relax. Now we're at T1. A little more on the right side. You okay? Lift your head up and back down. Right leg went short again. So we're going to actually adjust right at C5 in here. This may sting a little bit.
Oh! Oh my God! Ow! Oh!
Breathe.
Oh!
All right, turn your head to the right for me.
Oh!
Look at the range of motion coming
Oh
back.
my God!
Back to the middle.
Oh!
Curtis, you're all checked up.
Yeah.
Goodness. Now, the adjustments don't all have to be that hard. In this situation, we're using more manual and helping him out. His neck was really out of alignment and putting pressure on there. So some chiropractors, you may see this thing called, I don't know what they call it, a ring dinger. It's actually not really called that. It's a manual traction. It's taught by biophysics or even Pedibond-tech. So it's this type of style or technique that's being done. Very helpful to patients, and there's different ways that each doctor does it. Now I'm going to do a little distraction on this side where I'm going to traction out. You may feel a little releasing here. It's going to be a little sore. We even get some laughter in with our adjustments.
Oh, yeah.
Try turning your head to the right. Is that huge or what?
Oh yeah. Oh goodness.
All right, breathe. All right, so he's doing a really good job. He's letting me in on that area. So now we're going to actually use the instrument on C1 Atlas. So when chiropractors adjust this area has 21 different directions it can misalign. And so chiropractors go and adjust typically the primary area. So that's what I'm adjusting on. I'm using one of the stylus ends to adjust that. For every second I do this, there's 12 impulses coming out of here to make that change. Turn your head right for me. And back to the middle. Can you see how quickly his head was moving and turning and the muscles were responding quicker? Now there's a healing time to this, and none of us are like Harry Potter where we can wave our wand and it completely goes away. Especially when you come in. Sometimes we get this lucky, sometimes we don't. You know, it's up to the body to really do that kind of healing in there. Gently push your head into the table and relax. Take a deep breath and release it. Let's have you go on your back for me. And I'm going to have you come over this way if you can. I was careful not to have you down too long. I know I had you there. You did okay though. Good job. So we're going to do a little bit of cleanup work right here at Atlas. There it is. Just right below. Do you feel that restriction? So actually this would be a really good video for you guys. People say, well, I could crack my own back. Well, go ahead and crack your own back, but guess what, guys? You're only adjusting the easy areas that release. The chiropractor finds the restrictions and knows how to do that properly. I know about the teeth, but I still go to a dentist because I think a dentist does a better job than I do. Than that, I can brush them and floss them, but I can't do what they do. So, all right, you're gonna live.
Yeah, it's sore.
It's gonna be sore.
Gosh, that felt good. It hurt.
Been a while.
Good.
Anything you want to say to the viewers?
I feel fantastic.
It's been a long time. Was this your first adjustment?
This is my first ever.
Oh, you're not a newbie anymore. Good. I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. If you're suffering with back and neck pain, you know, you can have other things going on. And so the big thing, I think the message of this whole video is don't lose hope. And if you don't find the right chiropractor, look for them. It's kind of like trying on shoes. Sometimes you have to go out and find the right pair that fit, and you got to make sure that chiropractor feels right for you and working with you. So thank you for watching, and I'll see you soon.